So the purpose of this program, to support the function of the liver, the stomach, the bowels, the blood and kidneys as they filter toxins, xenobiotics, which is another fancy word for toxins, from the body. The procedure, now don't get nervous when you see meal replacement. Those are the shakes we make for you. We provide supplements and meal replacement to support the detoxification processes. It's a 21-day program that will support the elimination of chemical and environmental toxins. So this is the toxicity questionnaire that Dr. Huffer was speaking of. Now this will ask you just general questions about diet, lifestyle, work environment. And what you do is it's pretty self-explanatory. You add up each section. And if each section is more than a certain number, or the total I think is more than 35 or 40, then you'd be a candidate for the program as far as the toxic overload in the body. So what can be achieved on the program? Improve circulation, sleep patterns, hormone function. Now when I do the program, I don't do it for weight loss, I don't do it for cholesterol. I know there's certain things in the environment that I can't help. What I do notice is increased energy. And that's another reason alone that people will do this program, is for increased energy. It's so nice to go throughout the day and not think about how comfortable your bed is. And you're sitting at work and not getting drowsy, but being able to go the whole day working through it without being tired. Now weight loss. This is probably the number one thing that made the program popular. Average weight loss is 8 to 12 pounds, but your body loses what it has to lose. When I do the program, I lose about 1 pound. Some lose less. Some will lose a pound a day every day that they're on the program and continue the weight loss afterwards. What this program is doing is getting your body to its natural state. And since it's only secondary, it's just the side effect of eating healthy and cleansing the liver, your body will get it where it wants to be. Now the doctors can make adjustments to those individuals that are more athletic and don't want to lose weight, or for some that do want to lose more weight, it can be adjusted for you with added protein and taking protein away and so forth. Improved digestion and elimination. This is another reason some will do the program. A story I like to tell is we have a doctor up north who had a patient do the program. And if you ask someone if they have normal digestion, they'll think it's once every 3 to 4 days. Which isn't the case. That's not good digestion. This patient found the program to be a huge inconvenience because she was going every day. And I think it's kind of funny when we're so used to being far from health that when we become healthy, we find it to be an inconvenience. So proper elimination is very necessary. If we're eating foods that have toxins, we want to be able to eliminate them. Reduce allergies, headaches, joint muscle pain. That was explained in that leaky gut video, when we have our gut lining that's compromised. So when I talked about those cholesterol numbers, what we have here are pre and post lipid panels. And do you work with the lab here for the patients to have the lipid panels on?
There's a couple, yeah.
Okay, so just ask the doctors if you would like to do the pre and post lipid panel, and they'll direct you where to go. But what was healthy cholesterol 50 or more years ago? It's around 250, 300. The number was up there. It's a lot lower now. But we are actually the society here in the United States that has the highest incidence of chronic diseases, yet we have the lowest cholesterol number. So maybe they're kind of looking at the wrong picture and just a symptom. So if you're a patient that's thinking about a statin drug, your prescribing doctors want you to go on one, I recommend doing a pre and post lipid panel. And what you'll see here are patients' results that did the program before and after. And there's no drug that will actually do it this fast and actually do it the right way at the foundational issue. So with that said, this one here, cholesterol is 263, which isn't horrible. Went down to 178 just from eating properly for 21 days and doing the program. Triglycerides, 181, went down to 107. And LDL, which is considered the bad cholesterol. If you really understand cholesterol, there's no such thing as a bad cholesterol. But went from 174 to 107. This one is bad. Cholesterol, 344, went down to 182. Triglycerides, 787, went down to 108. And heart risk, which they use a ratio of the different types of cholesterol, went from 7.2 to 3.7. Now last one, cholesterol 230, went down to 185. Triglycerides 145, went down to 85. And a heart risk of 5.5, went down to 5.0. Now again, this is from eating green cruciferous vegetables, cutting out that junk from our diet, and making sure our liver can process these foods properly. Now I'm going to talk a little bit about cholesterol. I will say that our body makes it naturally. It's actually there for the permeability of our vessels. Okay? So when they try and attack cholesterol, what cholesterol is sort of a scab for our vessels. So what we need to ask is, well, what is it trying to scab? What is it covering up? What is damaging our vessels? What's damaging our vessels is sugar. Sugar is actually creating those little tears and causing the problems that cholesterol needs to be there. So just like that blood pressure medication example, would it make more sense to address the foods that are causing the need for cholesterol? Would it make more sense to not do that drug and address the foods? So what are the products on the program? What we're going to make the shakes of is the SP Complete. And there's a reason we make the shakes for you here, in that when you see the ingredients, they're typically foods we don't eat because they don't taste good. So we have to make sure you know how to make the shakes properly. SP Cleanse, you're doing the first 7 days. You're doing a fiber, and you're doing SP Green Food. And I'll go into these in more detail. So everything I go on from this point out is in a booklet that comes with the kit, if you're interested in doing that, which will tell you how much of this to take and when to take them. So I'm going to go through some of these ingredients. So whey protein in SP Complete, flax meal, brown rice, buckwheat juice, Brussels sprouts, kale powder, choline, carrot powder, alfalfa powder, barley grass, and inositol. Now these two parts are of the B vitamin, which they're called the lipotrophic factor. They actually take fat out of the liver, put it in the blood so it can leave the body. Now who's eating their buckwheat juice, their Brussels sprouts, their kale, their barley, or their alfalfa today? Or even in the past week? A lot of us typically aren't eating these foods, but these are the foods we used to have in our diet that got phase 1 and phase 2 working. We're simply not eating them anymore.